find very helpful is having a framework for understanding how we improve public health. This is because it helps me to categorize approaches and determine their strengths and weaknesses. In this lecture, I'm going to be talking to you about three general strategies which are commonly used in public health interventions. They're called the high-risk approach, the improving the average approach, and the disparities approach. Now, before I explain what they are, I want to share a bit of context. First, all of these approaches are helpful, but some may work better in certain circumstances than others. It really depends on the context of the intervention and the characteristics of the disease that's being addressed. Second, these approaches aren't necessarily in conflict. They can be combined as multiple dimensions of a health improvement effort to be more effective in addressing a health issue. So don't be surprised later on if you see interventions that adapt multiple strategies. All right. So you can visualize what these three strategies are doing. I'm going to be using pictures. Specifically, I'm going to be showing you a bell curve which represents the distribution of disease risk within a population. As you go up the y-axis, the number of people increases, while going up the x-axis increases the amount of risk those people have for a disease. So, for example, imagine we're talking about hypertension or high blood pressure. In this image, you have a few people with really low blood pressure, most people with average blood pressure, and a few people with high blood pressure. In public health, we generally want to help people decrease blood pressure levels because it leads to heart attacks and other diseases. There are a few methods for doing this, such as changing diet, taking medications, decreasing stress, etc. For the purposes of the lecture, I'm going to focus on exercise as an intervention. Okay? People who are physically active have a lower heart rate and decreased pressure on their arteries. Now let's take a look at the first general public health strategy. All right, here is the high-risk approach. In brief, this strategy involves finding the people who are at high risk for the disease. Then you target those specific people with an intervention, hopefully bringing their risk down to a normal level. So in the picture, you see the high-risk group being identified. Then the arrow shows the strategy decreases their risk and adds those folks to the above median grouping, making it larger. Let's go back to the example of hypertension. You know how when you go in for a checkup, they always test your blood pressure? Well, there's a reason for that. If you have a high blood pressure, your clinician will start talking to you about how you can bring it back to normal. Let's say we are focusing on exercise as a solution. Well, for a high-risk approach, we would create a program that teaches people who have hypertension how to work out at a gym. Hopefully that, perhaps along with other efforts, would help them to bring their hypertension down to a normal level. Now remember, this high-risk intervention is only focused on people with high blood pressure. It wouldn't apply to people who don't meet this criteria. Overall, the high-risk approach works quite well when you can easily identify a high-risk group, and a large portion of them would actually progress to getting the disease if changes aren't made. Now, there are some limitations to this approach. For example, for this strategy to work, you need to have a good way of determining who is really at high risk. We have that for some diseases, like hypertension, but for others it can be unclear. Also, I should note that these high-risk approaches often require a lot of resources and effort to be devoted to a fairly small number of people in the population. Now let's compare this to another approach. This is called the improving the average approach. In brief, this strategy aims to decrease the risk factors for the entire population. In the picture, what we see is a normal bell curve for a disease. And the arrow shows that after the intervention is completed, the entire curve has shifted to a lower risk level. So what might this look like if we were trying to prevent hypertension with exercise? Well, you could decide to create a public awareness campaign about the benefits of exercise, which could be broadcasted and publicized widely. In theory, the intention is that anybody who encounters this information might change their behavior. Note that in this example, the entire population is a target, not just a specific high-risk individuals. Because everyone can benefit from the exercise, the hope is that there will be a benefit across all of society, and we would see the risk levels go down across the board, resulting in a lower average risk. Okay, overall, this strategy works really well when a lot of the population is at risk, and there's some known risk factor that could be relatively easily removed and thereby benefit everyone. This strategy does have some limitations. For one, it is often hard to make changes that influence the entire population due to expense or political barriers. It would also require a beneficial behavior or action that helps everyone. For some diseases, this just isn't known. All right, let's look at a third strategy. This is the disparities approach to improving public health. Basically, the idea behind this relates to the distribution of disease within a society. The way that this strategy works is by reallocating resources so that instead of having a huge difference in health risks within the population, people are more equally at risk. I get that this is a bit complicated, so let me describe it in a bit more detail. We know that in most societies, the distribution of disease is not equal. For example, people with a lot of money and resources tend to have much lower risk than people who don't have money to access healthcare resources. As a result, there can be a really wide spread in the distribution of disease risk, as is shown by the top figure. The disparities approach is based on the assumption that we are better and healthier society if we are more equal. So, for example, in the case of low-income groups, tax money can be diverted to provide healthcare to folks who can't afford it. On average, that would change the shape of the curve, bringing everyone to a more equal level. You can see this in the figure at the bottom, where the curve has changed shape so that it's higher and there's less difference in risk between the best off and the worst off in the chart. One major way that this is was attempted recently was with the Affordable Care Act, where tax funds were redirected to provide access to health insurance for people who weren't covered. Now let's return to the idea of addressing hypertension through exercise. Here's an example of the disparities approach for this problem. We know that exercise can be hard to pursue in low-income communities. There are many reasons for this, but one of them is that these communities often have a lack of parks and public spaces, functioning sidewalks, and other spaces where one can safely exercise. A disparities approach intervention would be a state law that mandated funding and equal creation of publicly accessible spaces and resources and for exercise. This could, in theory, make a huge difference for communities that are lacking these resources. By comparison, wealthy communities often already have adequate access, and therefore they would not particularly benefit from this law. So in many senses, this intervention is reallocating resources to create a more even playing field with respect to exercise across communities. Overall, the disparities approach works well in situations where a known health disparity exists, which is true of most diseases, and there's a solution that is relatively feasible. The limitations of the disparities approach are typically political. Unfortunately, the people who have the most political power tend to be those who already have the most resources. So it can sometimes be difficult to build enough support for these approaches when they are expensive. All right, so these are the three major strategies for improving public health in populations. As you go forward in this course, you'll see many examples, and it can be helpful to remember this framework because it clarifies the goals, benefits, and limitations. Also, as mentioned earlier, in the real-world interventions can be complex and sometimes involve the combination of these strategies. But really, in most cases, at least one of these three models are relevant. Great. So that's about it for now. Take care, and we'll talk more about these issues in the future.